This is Professor McGinley. Today's lecture is going to cover another complication of pregnancy. The topic for discussion in this lecture is ectopic pregnancy. As you can see by this slide, there are a variety of places where a pregnancy can implant other than the uterus, and any implantation that occurs outside of the uterus is considered an ectopic pregnancy. 95% of the time, the ectopic is going to be located somewhere in the fallopian tube, but you can see there are a lot of other places that are at risk. So speaking of risk, what are the risk factors for developing a pregnancy outside of the uterus? Well, anything that alters the condition of the actual fallopian tube. Therefore, the tube is more narrow than it should be. There may be scarring. There also may be altered motility of the egg as it goes from the ovary, enters into the fallopian tube, and travels down into the uterus to implant. So this scarring can be as a result of having had a previous ectopic pregnancy, having a pelvic inflammatory disease due to a sexually transmitted disease such as chlamydia or gonorrhea. So it would be important for us to obtain this information when getting a history, but this is not anything that we need to know right now. Right now, when the patient presents, we need to see how ill she is, how life-threatening the situation is, and then we can get the history later. A woman may also have abnormalities of her tubes that she was born with, and of course it wouldn't manifest itself until she actually became pregnant. A woman who has endometriosis may have implants within the tube. This narrows the lumen and alters the path of travel to the uterus. If a woman has an IUD present, there is an increased risk of developing an ectopic pregnancy. And a woman who has undergone in vitro fertilization has a risk, primarily because there was some abnormality in her anatomy that was preventing her to get pregnant in the first place. Signs and symptoms as this woman presents to the clinic, outpatient office, or the emergency room, including, number one, missing the period. She may or may not have early signs of pregnancy. It really depends on where this ectopic pregnancy is located. The smaller and more compact that it's located in the anatomy, the earlier the signs and symptoms are actually going to be present. If an ectopic pregnancy is just deep in the pelvis, there's a lot of room for it to grow, and it isn't until it actually ruptures that this woman is going to present to us saying, I have belly pain, I don't feel well, and gee, I'm not sure when I had my period last. But typically, when you think about 95% of them are in the tube, this woman is going to complain of abdominal pain on either the right or the left side. If there's a rupture, then it's going to be diffuse lower abdominal pain throughout the abdomen. When we palpate the abdomen, there's going to be tenderness. When the physician or nurse practitioner does the pelvic exam and we do the bimanual exam, just the slight motion of the cervix will cause a lot of adnexal tenderness. She may present with spotting. In addition, she may or may not have had a pregnancy test, and so if you're suspicious that she's missed her period, she's having some spotting, she's having abdominal pain, the nurse should go ahead and collect at least a urine test and see if she is indeed pregnant. Additional signs and symptoms include Cullen's sign, and this is a very interesting finding, one of which I have never actually seen, but when you develop abdominal bleeding, you end up having a purplish discoloration around the umbilicus. Very few patients are actually going to present with this. They're going to have the more common signs and symptoms. If this ectopic is ruptured, she's going to feel dizzy, may feel faint due to blood loss. Because of irritation of blood as it's in the pelvis, it irritates the phrenic nerve that is right below the diaphragm, and there can be referred shoulder pain to the right side. If the hemorrhage is actually profuse, this patient's going to be showing signs and symptoms of hypovolemic shock. If it's a slow bleed and there's quite an accumulation of blood in the abdomen is going to be very rigid yet tender. So that's why it's very important that we get that pregnancy test early. It's important for you to know that a patient who presents with an ectopic pregnancy may be acutely ill because of the hemorrhage. This is a medical emergency, and this patient needs to be put in front of a provider upon presentation to the emergency room or the clinic or the office. So what are our nursing interventions? Well, we're going to start an IV. We need to hydrate this patient. We need to get the vital signs. So think about it. What are you going to be looking for? Low blood pressure, high pulse, may have rapid respirations. Identify and prevent hypovolemic shock by giving her bolus of fluids, having her lie down. We'll do an ultrasound to try and detect where indeed this pregnancy is located. Labs are going to be sent. We want to get a hemoglobin and hematocrit for a baseline. We can identify that she actually is having quite a significant blood loss by that H&H. We may also be sending off a type of cross-match because if she's hemorrhaged significantly, we're going to have to give her blood products. And then we want to collect a serum HCG level because depending on the treatment, we're going to be following these HCGs until they go back down to 0. You want to place your patient NPO because at the time that she presents, you don't really know how the management is going to go. So make her NPO, and there is going to be a possibility of surgery, so we'll need to get the consents. We need to do the patient education. In addition, this patient has a lot of pain, and so we will give her morphine or Dilaudid IV push to help control the pain. The next several slides are very good depictions of the laparoscopic approach to remove the ectopic pregnancy and the variety of places where an ectopic pregnancy can be located in the abdomen. So go ahead and put the presentation on pause as each slide advances so that you can get a good look at each picture. One of them actually has twins. See if you can identify where these twins are in the fallopian tube. Also keep in mind that a ruptured ectopic pregnancy is the primary cause of maternal mortality in the first trimester. Do not miss this. So management of ectopic pregnancy can be either medical or surgical. If they do surgical, they can do a salpingostomy where they're actually going to slice the tube open and remove the products of conception and then close it back up again. Or if it's ruptured and there's too much damage to the tube, we're going to go ahead and remove the fallopian tube that is affected. And they can do this through the laparoscopic approach. The medical management includes the use of methotrexate. So I've given you the dose of 5 milligrams per meter squared that's given IM, and some protocols are a one-time injection and others have multiple injections. But what we're going to do is have this woman come back every several days and have her HCG levels. What the methotrexate does is it interferes with the folic acid that's needed for cell division. So it stops the cell division so the ectopic pregnancy can no longer grow. It dies and eventually withers away with no surgical intervention. So every 3 days she needs to have an HCG level because remember, it doubles or triples every 3 days. It's going to go down every 2 to 3 days in the same manner. Because of the toxic effects of methotrexate, we're also going to be following this patient's liver function studies. Be sure to provide a lot of emotional support. This is life-threatening. It's very frightening for the patient. She has pain, she has bleeding, her life is threatened, and she needs to have the emotional support. Any of these treatments can also increase the risk that this patient may have a future ectopic pregnancy. So anytime she misses her period, she needs to make sure to come to the clinic or the office for early prenatal care so we can determine where that pregnancy is located. Thank you for listening to the lecture on ectopic.